I'm Tina Martimianakis, 2017 AMS Phoenix Fellow. My background is in sociology and politics of education. I study professional identity and how it intersects with the way we govern and support educational environments. I work embedded in a clinical department, the Department of Pediatrics at Sick Kids Hospital. And I'm also a Wilson Center scientist. And working in a large urban center like Toronto, where a lot of healthcare and healthcare education happens, is a great luxury and a privilege, but also a huge responsibility, I think. My AMS Phoenix project looks at the way in which change agendas affect professional identity. I'm interested in exploring how the rewriting of what counts and matters in healthcare actually challenges health professionals to rethink themselves in that healthcare environment. It starts with this notion of change and transformation amidst a culture where healthcare wants to do better. Right now at Sick Kids, we have 3 change agendas happening simultaneously. One is a quality improvement, one is a technology improvement, and one is an educational improvement effort, and they're coming down simultaneously. And the things that inspired me were thinking about how to connect my work in identity and health professional identity to what was happening in the organization. And AMS sponsored that project. So we're looking at ways in which different change agendas are impacting the way health professionals function in the practice of their expertise. And I see this as a fundamental dimension in thinking about really severe issues of burnout and compassion fatigue that are being documented empirically around Canada and also North America. Health professionals are struggling to keep up with the demands of healthcare. Our countries are struggling to keep up with the healthcare needs. The patient demographics are changing. So I don't think anyone would question that we need to change the way we fund, change the way we organize things and we administer healthcare. I think we should not also forget that while we're changing the environment of healthcare, we're also potentially affecting the people in it. And we're affecting their sense of professional identity, which, if we think about it, is composed of things like what they know, the attitudes, behaviors, and practices in terms of what they know and how to deliver that knowing. So that's the crux of my project. One applied aspect of my project was to think about how, in an era when competency by design is being implemented and we start piloting this new way of training health professionals, can we do it in a way that's compassionate to the learners? Because they too shoulder a lot of these change agendas. They too need to learn how to function and succeed in ways in which they may no longer apply. When you change the model of education, you change also the ways in which people are expected to perform in order to be successful. So that's what we did the first year of the fellowship. As we were starting the research, looking at how people's identities were being affected and sense of self, we were also putting programming in place so that faculty and learners can think proactively about the potential unintended effects of rolling out new educational modalities, and how we can do it in a way that takes into consideration resident work hours, resident sense of purpose, and support both the faculty and the residents through this transition. The work is funded by a foundation that really wants to see transformation. And what I'm doing with my fellowship is actually slowing down and seeing the effect of transformation, and how can well-intended change agendas be supported in a way that they are compassionate to the people that have to shoulder them.